As part of the ongoing project to record the visual and actual history of the American College of Obstetricians and Gynecologists, we're here in Honolulu, Hawaii today to interview one of our founding Life Fellows, Dr. Colin C. McCorriston. Dr. McCorriston, I want to thank you for the willingness to participate in this ongoing project. And I wonder if I could ask you a few questions for our viewers about your background.
Certainly.
Could you tell me where you grew up?
I grew up in Honolulu, Hawaii. My family goes back to 1850. Some of them immigrated here from Tasmania on their way to the California Gold Rush. Had a heck of a time getting this far, stayed and liked it, and so they decided to keep on staying here.
Well, the people of Hawaii are very fortunate that they made that decision. I understand that you went to high school here and then on to college and medical school on the mainland?
Yeah, yes, I did. I went to Stanford University as an undergraduate and then to Harvard Medical School after that.
And when did you graduate from medical school?
In 1939.
And following that, you took special training in surgery, pathology, and ultimately leading to obstetrics and gynecology. Could you tell me a little bit about that?
Well, after medical school, I was an assistant in the pathology department at Stanford University. Dr. William Dock was the professor of pathology at that time. And then I went back to the Boston University service at Boston City Hospital for a 2-year surgical appointment, which was shortened by the war to 20 months, following which I spent 6 months as resident in urology in the same institute.
And then you returned to Honolulu around that time? At
that time, there weren't as many OBGYN residencies, and the boards approved preceptors. My 2 preceptors were Dr. Guy Seal Milner, who was very well known to Lou Emge and professor in San Francisco at Stanford, and Dr. Herbert Bowles was very well known to Norman Miller at the University of Michigan.
When did you return? You were in the war, I understand.
Well, I returned in 1942 to Honolulu, and then later on I got in the Navy and was stationed in Honolulu part of the time, and then at sea on a destroyer for several months.
And when did you return and begin to practice obstetrics and gynecology?
October 1942.
Now, I understand that in 1949 you were president of the Honolulu County OBGYN Society?
Yeah, the Honolulu Obstetrical and Gynecological Society. I was president of it then.
At that time, you must have been one of the very few trained obstetrician gynecologists in Honolulu.
There were not very many, that's true. Right after World War II, we were very busy because there weren't very many OBGYN people in Honolulu. And one of my partners at one time wrote a apologia to the members of the group we were in because we're no longer delivering 50 babies a month apiece.
Well, that's a lot of babies to deliver. In 1949, you represented the Honolulu County OBGYN Society at a meeting of during the AMA meeting at Atlantic City. Could you tell me a little bit about that meeting? Well,
it was an association of OB-GYN city organizations that met in Atlantic City at the time of the AMA meeting, and the purpose was to try to form a college of obstetrics and gynecology. Prior to that time, our only access to that was a poor relative of the American College of Surgeons, and we felt that we should be more aggressively organized as an organization of our own. And there were meetings from all over the country. I distinctly remember Dr. Woody Beecham from New Orleans being there, and Dr. Beecham from Philadelphia being there, whom we sort of elected as our lead man. And I'm pretty sure Dr. Joseph Baer from Chicago was there, but there were representatives of many city medical OBGYN societies from all over the country. there must have, in recollection, there must have been 20 or 30 different representatives there at this meeting.
During this meeting, what were the topics that they discussed?
The main thing we discussed was the formation of the American College of Obstetrics and Gynecology. One thing that was brought up and discussed was who should be a member. And I suggested that it should not be completely restricted to people who already had their American boards, because at that time there were many people, older people in particular, through the country who had done a lot for obstetrics and gynecology, very competent people, and that there should be a grandfather clause. This was discussed at some length. In particular, I proposed that there should be a grandfather clause for some of these people who were important in helping the progress of obstetrics and gynecology in the United States, but that in the future it should be restricted to members of the board. After some discussion, and I was completely supported by Dr. Woody Beecham and others, this was passed.
I understand that in your past history, you had some time with Dr. Art Hurtig in Boston?
Yes, I took some postgraduate work with Dr. Arthur Hurtig at Free Hospital for Women at that time in Brookline, Massachusetts, suburb of Boston, and in OB/GYN pathology, and was very, very helpful. And I enjoyed that a lot.
I understand Dr. Robert Noyes was there at the same time doing his
Dr. Robert
work?
Noyes was there at the same time with me, yes.
And I assume that was when he was doing his work on the dating of the endometrium?
That is correct.
Well, that was a very important part of our history that you were participating in.
Yeah, I worked on that same thing too, but I was not there long enough to be a published associate of the paper that was presented by Dr. Hurtig and Dr. Noyes.
Let me take you back to the meeting in Atlantic City. Did you have any follow-up after that meeting? Were there any other meetings that occurred later or correspondence?
Dr. Beecham from Philadelphia, as I recall, headed up the doers, and I was way out here in Hawaii as an appendage, and Dr. Beecham and his closer associates did the final polishing on the presentation and getting it going.
Well, Dr. McCorriston, do you have any other items you'd like to share with us about that part of our history of the college that you obviously participated in?
Well, I very much enjoyed being part of that and been an ardent member of the college ever since. And I practiced as a part-time attending at Kapiolani Hospital before the University of Hawaii became involved. I continued on when the University of Hawaii became involved in the department, and later on my good friend Ralph Hale, who became chairman professor of the department, appointed me a professor at the University of Hawaii, and I enjoyed the relationship, and especially the opportunity teaching medical students and residents ever since.
Dr. McCorriston, having been a participant in that, I want to tell you how much I know that the school appreciated it, and I personally did. And I want to thank you very, very personally for adding this information to the college history. In my review of the activities that led to the formation of what was originally the academy and ultimately the college, this is the first that we have found of anyone who participated in that meeting in 1949 in Atlantic City. So thank you on behalf of the college. You've added another little part to our picture of how we got to where we are today.